How long after having Mummy Makeover (brackets tummy tuck and breast lift) can I return to weightlifting? Look at that, weightlifting, flipping heck. Okay. Well, I'm guessing that the main one out of those two is going to be your tummy tuck. When you're having a tummy tuck and a breast lift, or kind of like a breast procedure, usually the tummy tuck is the overriding one in terms of the recovery. So first 2 weeks, don't do anything. Well, you can walk around, move, because you don't want to get a DVT and things, but moving and walking around, but nothing in terms of lifting or what have you. After 2 weeks, lower body stuff. I normally say in terms of upper body, like putting power through the upper body, a month is my normal recommendation. A month for putting power through the upper body. So I guess weightlifting would qualify as putting power through the upper body, but it sounds quite hardcore when you say it like that. When can I return to weightlifting? So I'd probably revise my month thing to say kind of like probably 6 weeks, and then just gently get into it. You're going to be engaging your core with weightlifting, so I'm going to say little weights. Don't want to be what's the word? I don't want to make out as if you're not able to carry big weights, but I would say start with those little dumbbells, little hand ones. Maybe after 4 to 6 weeks, but I wouldn't do anything with the big bar and engaging your core probably for a couple of months, and then I would just do a small one and then see how you feel, because we have to bring the muscles together often, not always, but often. Usually I would say we bring the rectus muscles together with stitches, so you don't really want to be putting an awful lot of tension on that, which I would imagine when you're doing weightlifting, you're going to put a lot of tension on that. So you want to give it a good couple of months before you start to do it. And that's the important word, start. Double underlined and highlighted the word start. So start to do it after a couple of months and see how you feel. If it hurts, if you feel it pull, oh my God, if it swells, back off, and then maybe leave it another few weeks. If you try and do stuff too soon, particularly if you're doing too much too soon, big heavy weights and stuff, then you run the risk of it. Well, worst case is swelling. I suppose best case is nothing, but if something bad's going to happen, swelling is the main thing. But I guess worst case, you could put tension on those stitches. You could potentially pull the stitches because you pain, could cause bleeding. Obviously putting tension on the wound as well, because the wound's under a lot of tension when you do a tummy tuck, and you'll find that you're kind of bent over double for a good couple of weeks afterwards. So yes, I would say good couple of months before you start doing upper body exercises. Then start gentle with just little dumbbells, I would say, and just see how you go, and probably a couple of months before you start with the bar, and even then maybe just start, because I've seen this, you can do the bar on its own, can't you? Because the bar itself has got weight. So just start with the bar on its own before you put any weights on. See how you feel. There's often a bit of a delayed reaction, so see how you feel. Give it do a little bit with the bar on its own, and see how you feel that evening, because sometimes you can think, oh, that feels all right, I'm going to put some weights on, do a bit of this, oh, I'm feeling good. You get home and you think, oh my God, what have I done? It's all swollen. So there's often a bit of a delayed reaction, so just be aware of that, be mindful of that.